Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadijah, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Hello and welcome back to Balanced Beauty Talks. Today we're going to talk about a system that quietly runs the show, your immune system. It's not just about cold and flus, it's about how you age, how your skin heals, and how your body responds to stress. Immune health right now really seems to be trending, and I think it's all started to kind of uptick through and post-pandemic.
Oh, yeah.
Everyone's immune systems have struggled for many reasons. It could be COVID itself. It could be the stress that we all underwent through that time, the over sanitation and the number that did on our immune system. The economic climate right now has added a lot more stress and tension to people's lives. And our healthcare system is, especially here in Canada, just really struggling and behind. And that really hasn't helped people in getting ahead of their health. We're kind of just chasing all the time rather than being preventative.
Yeah. I think it's good in a way that we're focusing on the immune system because of how much of an impact it has on your entire health and the role that the immune system plays holistically. I think a lot of people don't realize we kind of treat the immune system like its own system, but it is so closely related to other systems in the body. And I guess just what you're saying about stress in general and how that has an impact on your immune system, or when you get sick, when you're stressed, that in itself kind of shows you the impact of the immune system and how important it is to look at the entire body when you are thinking about the immune system.
Yeah, we're truly just an overworked society right now. We are constantly in, a state of stress. We're in fight or flight all the time. There's a lot of sleep problems. Our food quality has gone down. We're eating, because we're a little bit more of like a fast-paced society right now, we're eating a lot more on-the-go foods, which means usually more processed foods. Even our non-processed foods, the quality has gone down, where it's really hard to get organic, really hard to afford organic right now as well. And so, I just feel like the overall quality of what we're putting into our bodies has really gone down, which leads to immune burnout. And, stress doesn't have to just be mental stress. Like all of these poor quality foods and our environments all are stressors to us and impact the overall immune system and how it's going to be able to function and help us fight things off. And so when you collectively put all those things together, it's like a bucket that just keeps filling and then over pouring because we've just added too many stressors to the body and our mental health. So
Yeah, a lot of people don't realize that they're stressed. Like especially in consultations, when we talk about stress, we kind of have to dig a little bit more because stress isn't just mental stress. Your body interprets stress very differently. I think we've talked about this on other episodes, but there's a lot of things that your nervous system and your body will register as stress. And so those things will have an impact on your health and your immune system. And so you have to take those into account. It's not just, I feel mentally stressed, or I know like I'm going through this thing right now, and so I'm stressed about it, or I'm anticipating something, so I'm stressed. It's not necessarily conscious stress. It is body stress. It's environmental stress. It's a lot of other things.
Yeah. And so if you're noticing that you're just getting sick really, really often, it's not because your immune system is broken. It's just overwhelmed. It's overloaded. And so we have to look at your life as a whole and where we can eliminate some stressors to kind of put it at ease a little bit so we can fight off the things like colds and flus that I don't know about you, but I notice as soon as I start to slow down in my life, almost every time I have an opportunity to get away or just a day to myself, it almost always ends in a bit of a cold or flu or a virus or something. And it's just like your immune system holding off as long as it can because it's got this adrenaline to hold it off. And then the moment your body has a chance to just take a breath.
Yeah.
It's like your immune system's IOUs, you know?
Yeah. I remember that a lot I still experience this, but in school when you were like hanging on for exams.
Yeah.
And after exams, everyone's off and everyone is sick.
Yeah.
Like you're finally off, but everybody is sick because it catches up to you.
So true. So one thing that a lot of people don't even realize is how much the gut health is connected to our immune health and its ability to fight off colds, flus, viruses, etc. Can you go into a little bit more detail on how that is all connected?
Yeah. Yeah, I think a lot of people don't know that the gut is kind of the root of a lot of things. So with the immune system specifically, 70 to 80% of the immune system lives in the gut. And there's actually a name for that. It's called the GALT, or the gut-associated lymphoid tissue, which basically is actually just multiple components of tissue that reside in the gut that are responsible for supporting your immune system or responding to threats. So the GALT is this communication between your gut, your digestive system, and your immune system. And I think the most important part of this is actually the gut bacteria, because the gut bacteria are kind of the foundation of that immune signaling that is happening in your gut. The gut bacteria supports all those immune cells to appropriately signal when they need to, so that those immune cells are determining what is a foreign body and what is harmless to your body. But if the gut bacteria, for example, is off, or you have something called dysbiosis, which is just a overgrowth potentially of bad bacteria, then that signaling can be improperly firing. So you could be responding to things that are not necessarily threats, or you could be letting in things that typically your body would fight off pretty quickly. And so that's kind of when you get sick very frequently or getting cold and flus very frequently. So all of this kind of, when your immune system is consistently reacting and you have that dysbiosis, it kind of leads to a lot of inflammation in the gut, but in general in the body. And when you have a lot of inflammation in the gut, you kind of then lead into a leaky gut, which a lot of people have heard of now. But that is a direct response to inflammation, because now the lining of the gut is getting weaker and weaker. And so those cells can't stay together. There are specific components in each cell that hold cells together, and those get weaker. And so you get this leaking of proteins and leaking of food into the blood. And that's what causes food sensitivities. And that just perpetuates more gut issues. So both of them are kind of falling apart together. And both of them rely on each other to function appropriately, because there's so much signaling happening. But I feel like a lot of it goes back to the microbiome, which is why we focus so much on gut bacteria and gut health with probiotics and everything else that supports the gut bacteria.
And for those of you who might not know, like some of the things that really sabotage gut health are things like antibiotics. Again, there's a time and a place for them, but we have to work on the reinoculation afterwards as well. Low stomach acid, poor food choices, lots of sugar, lots of stress, all of those. Even though stress is not something you're digesting, it is still super impactful to overall gut health as well, and how you're digesting your food. Because if you're in fight or flight, you're not properly breaking down and assimilating those nutrients, which creates a lot of inflammation in the gut. So
I feel like it typically starts from the basics of digestion, which again starts in your nervous system. So if those things aren't lined up appropriately, your body doesn't digest appropriately, and then you create this space for dysbiosis and inflammation and everything to occur.
Another big one is chronic dieting.
Yeah.
Unfortunately, that can do a real number on people's guts. And in women, I see that a lot with intermittent fasting. Intermittent fasting, again, can be beautiful and when done right and for the right people. And I could go on about it. There's great things about it. However, it can make things a little challenging if your gut is already compromised. So.
Yeah. Fasting. I mean, again, I think fasting can be really good, but fasting can also be a stress. Like your body will respond to it as a stressor. And so that's when you get all these downstream effects, because your body is now on alert that there's a stress response occurring. And then you get your immune system gets affected. All the other systems kind of start getting affected.
Exactly. So again, just for the right individual, where are you at? How's your gut? Where's your stress at?
And we work obviously with skin a lot, and we go back to the gut pretty much almost every time, because what I like to say is sometimes the skin is mirroring what's happening in the gut. So when you see things like acne or inflamed skin, eczema, a lot of redness in the skin, that impaired barrier, a lot of that's actually already happening in your gut too. So you can kind of look at it as the same picture of what's happening in your gut, but you have to go back to your gut because it happens in your gut first. Your skin's kind of one of the last things to respond. And then we usually kind of work our way up from the gut to the skin.
Yeah. And to the contrary of that, the skin is also, a front line immune defense. It's the barrier. That barrier is something that is so important to keep healthy, to make sure that it's having a proper immune response to those environmental factors. So, the barrier consists of corneocytes, which is like the bricks of the skin. And then you have the lipids, which is like the mortar. And then you have the natural moisturizing factors. And then you have the microbiome, which is like the little ecosystem or the little village of bacteria that are so important. And when those are compromised, whether that be through environmental stressors, harsh acids, overexfoliation, just the wrong products, a barrier breakdown from wrong treatments or anything like that, then you're kind of like evicting that little ecosystem and that little village. And then they're no longer there to support and to fight and to really react and respond appropriately to those environmental stressors. So then your skin is more prone to inflammatory conditions, eczema, acne, psoriasis, any of those things will come into play. So it's really important in the whole overall immune response. And the skin's immune system and the gut's immune system work synergistically and support the overall immune system and how our body is going to function and fight things off. So we are so proud of the Natology Method. We look at that interconnection, we look at root cause, and we like to bring those two together. There's a place to work externally and internally for the immune system.
I feel like immunity and the immune system is kind of one of the areas that naturopathic medicine really shines, because there is a lot we can do to support immunity. Like we said, your immune system is closely related to your stress response. And so your cortisol, your melatonin, both of these are cycling hormones, and they're related to your sleep-wake cycle. So your sleep is when melatonin takes over, and when you're awake, you have cortisol. And so you need these to be functioning appropriately to have, honestly, a full body, a healthy body. But typically, because of the way we live and because of stress, our responses to melatonin and cortisol aren't great. We don't always produce it when we should be. We're overproducing some in certain times of day when we shouldn't be. So you want your cortisol to nicely rise in the morning and stay up for a little bit, and then have this curve that kind of goes down and drops at the end of the day. And usually cortisol is dropping actually around 8 to 11 p.m. But for a lot of people, it's not actually dropping at the appropriate time. A lot of people get a drop earlier in the day, and then it shoots back up later on in the day, or it's just staying up for a really long time, or people are staying awake past a certain point, and so their cortisol is rising again. And so if your cortisol is doing that, your melatonin doesn't have a chance to take over. You need that cortisol to go down nicely so that melatonin can take over appropriately and allow you to get into a deeper sleep. So that, I feel like most people have some sort of struggle with sleep, whether it's falling asleep or staying asleep, very restless sleep. And so if these are functioning appropriately, then your immune system will also respond appropriately. Outside of that, I feel like nutrition and supplements play a huge role in immune health.
Yeah, so for nutrition, thinking really anti-inflammatory as best as possible. So anything inflammatory is like your processed foods, high sugar, seed oils, things like that. And so we really want to work on like getting all colors of the rainbow instead. Good healthy fats like avocado and nuts and seeds. Mushrooms can be a really powerful food as well, especially in immunity and stress management. So yeah, just thinking of a well-balanced diet. And again, when we're talking about those hormones, we really want to make sure that we're not only getting those nutrients in, but the way that we are grouping them together can be really helpful in preventing the way that our body is responding to that food and overall insulin spikes or cortisol spikes. And so making sure that you're having well-balanced snacks or meals. So there's some protein, some fat, and some of your carbohydrates in combination together to really help with the way the body responds over something just like really processed. If you go for a croissant one day, like that's just going to give you a quick spike and no nutritional value whatsoever, which again adds to the stress that your body's already dealing with. It's just one more environmental factor that can contribute to your immune system being in overload. So
yeah. Something else too with food is, again, thinking about the energetics of food too. A lot of those warming foods are so good for the immune system, which is why I think as the weather gets colder, we tend to obviously lean towards those foods. Yeah, soups and stews, a lot of root vegetables, like the things that are actually available at this time of year anyway, are very warming to the body energetically. And in Chinese medicine, colds and flus are considered cold invasion. And so it is basically cold invading the body, causing you to have an immune response. And so keeping your body as warm as possible externally, but also warming your body internally with those foods can be really helpful.
We as humans and like our world and our environment, we do work so synergistically together. And like if you really just sit and, ground yourself and think about like what is it that is in season right now? And your body is truly designed to have what is in season from the environment that you are born in.
Yeah.
And like we work synergistically. And so it's really kind of just rooting yourself into the earth and what it can provide us can go a really long way in supporting the body in the times and seasons that it's in.
Yeah. Yeah. There's a reason that like pumpkin spice and ginger and all those things come this time. I mean, we're cold, but also it's because your body intuitively knows what it needs at this time to get through. Like this is the season of hibernation and slowing down. And those are the things that are part of our lifestyle at this time for a reason.
Exactly. It's really cool.
Yeah, it is. Another kind of foundational thing for immunity is movement. Movement is medicine. There's many different reasons why movement can support immune health. One of them obviously is kind of a stress release for people. But another big one that people don't realize is that it supports the lymphatic system. The lymphatic system is basically responsible for detoxifying your body. So it removes toxins from your blood, and it doesn't have the same system as your circulation. So it doesn't have valves that pump. It relies on muscles to cause that movement. And so if your muscles are stagnant, you're not getting that lymphatic movement. So you really need movement. You need your muscles to be working in order to push that lymph throughout your body. So it is detoxifying things from your body. So a lot of the times, I mean, we naturally want to slow down in the winter and it's harder to get that exercise, but it is still just as important. You can maybe switch things up in terms of what kind of exercise you're doing, but it is so important for circulation, but especially for your lymphatic system.
And putting your body through the small stress of a workout can also really help to build resilience too in other stressors, which is a really important factor as well. So,
And then we've obviously touched on stress already, but emotional stress really takes a toll on the immune system. And so kind of whatever stress release practices work for you. Again, I keep going back to wintertime just because this is when the immune system has the toughest time, or when we get most colds and flus. Anything that can help you kind of slow down and calm your nervous system, really working on the vagus nerve, because the vagus nerve is responsible for putting you into the parasympathetic state of your nervous system, which is your rest and digest. And so deep breathing, meditation, journaling, practices like that can kind of really ground you are going to be important. Deep breathing, your vagus nerve runs through your diaphragm, which is why deep breathing is so beneficial for supporting the parasympathetic nervous system, because that activation of that muscle is what really it's almost like a massage for your vagus nerve. And so it puts your brain into that state very gently and very intuitively. So people, I mean, deep breathing, yes, it calms you down because you're physically doing something, but it is actually working on specifically on your vagus nerve, which is why it's so helpful.
And you don't have to think about it as a whole, like 10-minute exercise. Like just sit there, take 3 deep breaths, and it does a miracle.
Yeah,
so.
Exactly. So I think in general with the immune system, you want to think about, I like to think about the immune system, nourishing the immune system. So all of these things are nourishment. Like we're not restricting in any way. We're kind of doing a lot more adding at this time, adding things that are going to be deeply nourishing, setting the foundation of your health, just going back to basics. This doesn't have to be, I mean, there's just so many things out there now in the wellness world and biohacking and all of that. But I think going back to just the basics is so helpful with the immune system. It is kind of like a gentle system because it's so closely related to stress and your digestion that there is very foundational, simple things you can do to nourish yourself.
Totally. Yeah, it's not about like cranking your immune system. It's just about keeping a rhythm and supporting it and nourishing it and, giving it the best possible chance to fight anything off. So,
Exactly.
What about supplements? What would you recommend are good supplements that one could maybe think about taking?
There's a lot for the immune system. I think the ones that people know the most are your antioxidants. So vitamin C is a big one. Vitamin D, I feel like I lean on vitamin D more than vitamin C, especially when I feel a cold coming on. I will do a higher dose of vitamin D and I feel like it just really helps. Zinc, obviously, selenium, vitamin A. Some of the lesser used ones, NAC or N-acetylcysteine, I love because that is a precursor to glutathione, which is your master antioxidant. And I find that I use NAC with patients also who have chronic coughs or bronchitis, asthma, some of those like deeper immune conditions, because it's very mucolytic. Like it's very good at breaking up mucus and really preventing people who get sick very frequently. NAC is like a really good foundational supplement to be on.
NAC had a real moment through the pandemic.
Yeah.
I was so happy to see that.
Yeah. Yeah. I love that one. Mushrooms, like we talked about in your diet, you can also have mushrooms as supplements. So one of the ones I love the most is cordyceps. It's a really good immune tonic. Mushrooms in general too, if you're getting it from your diet, almost every mushroom has some sort of medicinal property, except the white button mushrooms that people tend to use the most. Those have basically nothing in them.
Some water.
Yeah. Everything else, I like cremini mushrooms, like cooking with those, I feel like are really good, but there's lots of mushrooms out there. Herbs as well. Herbs you can take as a supplement, or this is a great time for teas. Turmeric, nettle tea. I love astragalus. Astragalus is a root that is often put in a lot of supplements, and it's a Chinese medicine herb, and it actually is it works on your qi. So it's a qi tonic. And qi is important again for fighting off pathogens. And so it's basically restoring your body's defenses. So that's actually a really, you'll see it a lot in supplements because of that reason. It's just a really good foundational immune herb. Obviously garlic and ginger, again, in supplements, but in cooking is probably the best. I used to make like a natural neocitrin back in school, which has a lot of these things like turmeric, garlic, ginger, lemon, honey, a little bit black pepper. It doesn't taste great, but you just blend all of that together, and then some hot water and a little bit of cayenne too. And it was good.
Nice.
Yeah. Because we talked about gut health, just supporting reducing inflammation in the gut. So L-glutamine is a really good one. So sometimes we'll go back to that for immune health. Is just L-glutamine is a anti-inflammatory, and it's kind of like it seals your gut. So it brings together the cells in the lining of the gut to stop that kind of leaky gut response. Slippery elm and marshmallow are very similar. They have this mucilaginous component to them. So you can think of it kind of like aloe. Both marshmallow and slippery elm, if you take these herbs and you add water to them, they become mucilaginous, or they become kind of like that aloe, that thick consistency. And that is what is lining your gut. So that is reducing inflammation. It's stopping anything from leaking into the blood. And so it's just a very nourishing, very healing, soothing kind of, both of those herbs are great for the digestive system and then in turn the immune system.
And of course, as we talk about the microbiome, the ecosystem, we want to make sure we're also supporting this in probiotics. Yeah, overall, supporting your immune system just really means supporting your skin's ability to heal, protect, and thrive too. And we need to think of it as a coexisting relationship. So if your skin feels off and you're breaking out more or you're more inflamed, don't just ask yourself, what products do I need to use? What treatment do I need? Those can be helpful in managing the external symptoms. However, you really need to look at what is my body signaling, and where are these stressors, and what can I eliminate, and what can I nourish? What can I bring in? Like all the suggestions that Khadijah made with lifestyle and supplementation, what can I add in there versus just adding more product to the menu?
But on the topic of product, because this kind of ties in. We brought in a new product that plays into both what we were just talking about with skin health, but also the immune health. And this is something I feel like people have kind of been touching on, but haven't done in the same way as this particular brand. So that's probiotics in skincare. And so we just brought in this, I guess it's kind of like a serum. It's called Civ, and it has spore-based probiotics in it. So this is a topical formulation with probiotics. And basically it's like calibrating your skin to rebalance the microbiome of your skin. And so when you do have like acne, eczema, or dermatitis, it is often an imbalance of the bacteria that's in your skin. And so having a product like that, I feel like kind of ties everything together, because you can do all this internal stuff and you can do the probiotics internally, but then you're getting this external probiotic too to balance things out.
And the nice thing about this product is it can be added to anyone's regime. It doesn't interact poorly with any other products, which is amazing. So just something, in fact, it'll probably help enhance the product. Yeah, it's a good foundational product. Okay, well, that's it for today, guys. Thanks so much for listening. Follow, like, subscribe, comment. Let us know what you want to hear next. We appreciate your feedback, and thanks for listening.
See you next time.
Bye.